Hello, ladies and gentlemen. I'd like to start off this presentation with a quote. Communication. The human connection is the key to personal and career success. That's something by Paul J. Meyer for us to all think about. Communication. The human connection is the key to personal and career success. My name is Shafatella Vichenikol. I am a registered nurse for the past 13 years. I work in a department for Kaiser Permanente. My department is called Primary Care Message Support. In my department, it consists of 12 nurses that work along the side with the doctor. Our nurses triage patients over the phone. We discuss test results with our patients over the phone. We go over education, educating our patients on diabetes, cholesterol, and STDs. We also review test results when doctors in Orange County are out on vacation or sick. We attach to their results electronically, and we review their test results, and if there's any interventions needed or some recommendations, then we reach out to doctors who are in and get some assistance with abnormal or critical results. And also, we take care of signing lab orders when patients are on certain medications that require certain lab monitoring. We take care of signing orders for those patients based on some what we call standing orders. So there's so that we're practicing within our scope of practice. Today I'm here to talk about communication in the workplace and how important it is. In my workplace, communication takes place with our patients, with our physicians, and with our colleagues, managers and supervisors. With our patients. So our calls are recorded. We're on a recorded line, and we go over instructions with our patients, which are very important. It's very important for the patient to understand what the nurse is saying. When a patient doesn't speak the same language as the nurse, for example, Mandarin or Hindi or any other language besides English or Spanish, then we reach out to an interpreter service, and an interpreter's on the line when we need to discuss test results or triage a patient over the phone or go over some instructions with the patient. So you can only imagine how important these instructions are with healthcare and in many different work environments. Another example of what we go over with patients is medication instructions. So if there's cholesterol comes back too high, we get some instructions or we receive some instructions from the doctor, and we relay that to the patient. And we ask patients, I personally ask my patients to please repeat the instructions that I had just given them to ensure that they understand. Also, another example of when we communicate with our patients is to ensure that they know when to call us back. So if we are triaging a patient and giving them some nursing advice and telling them that it's okay to stay home, they don't need to be seen right away, and giving them some instructions, some recommendations just to stay home, then we would also ensure that our patients know when to seek help. Know that, a lot of patients don't know when to get help, or if there's something that's concerning. Some patients don't even know when it's time to go to the emergency room, and that's why we're here, so that we can help them. And communication with our patients is just so important, and it determines how well we communicate with them, can help save their life, and it can help determine their health outcome. Next, of course, ultimately everything will affect like our patients. That's why we're here in our environment. Doctors, communicating with our doctors. So just like any work environment, when you're in the hospital or you're in the clinic, and now I'm working in an office, more of a clerical looking environment with the doctor, communication with our doctor develops trust. If we communicate professionally and articulate ourselves well with the doctor and making sure that we're advocating for our patients, our doctors will trust us. And the relationship we develop because of effective communication is very important. For example, some doctors, when receiving instructions on ordering antibiotics for a urinary infection, it's very important for us to communicate if the patient has allergies and exactly what the symptoms are, to ensure that it is safe to treat a patient over the phone and they don't necessarily need to be seen in the clinic. So we relay this information, the symptoms, to the doctor, and we receive an order. Usually there's certain medications that they prefer, like the drugs of choice when it comes to urinary tract infections, and making sure that we are receiving the verbal order and we're reading it back to the doctors, because we are signing on their behalf, and that's huge. That's very important. So that's how we communicate with our doctors and the importance of it. If we do not communicate well, that can lead to a breakdown of communication, and which would, the patient might need to come in to be seen, and that can be an inconvenience to the patient, when we could just treat them over the phone sometimes. Of course, a lot of us nurses believe that seeing a patient face to face is the best kind of an assessment, but a lot of our patients need help, and it's hard for them. They have transportation problems. They have, different reasons why they should they're immunocompromised. Maybe it could be better for them to just stay home, and receive care over the phone, and have a family member or a friend pick up their medication for them. So that's a really good service, to treat patients over the phone. And again, to communicate with the doctors is very important. Next, I'd like to discuss the way we communicate with our colleagues and with our supervisor and with our manager. So with our colleagues, we'd like to also maintain professional. If someone's going on a break and we are not able to reach our patient that's on our schedule, our telephone schedule, we would hand off to one of our colleagues. And that's very important, because we want to make sure that there's a continuity of care. If we were talking to the patient and we have to go on our lunch break, and that we received orders from a doctor and we can't reach the patient, it's very important for us to hand off to our colleague so that our colleague can call the patient and give them the right instructions. If someone one of us nurses is running behind, we communicate with each other by a group thread or text message. That's very important to keep everybody in the loop, because we are assigned to different duties per day. So if someone's running behind and they're in charge of signing orders on a given day, it's very important for them to communicate with the rest of the staff that they're running behind or they won't be there, so that the rest of the staff can pick up that work. So very important. Our supervisors, of course, we follow the chain of command. If something's going on, we have a concern, we don't know of a specific resource, we reach out to our nursing supervisor by text message or by an instant messenger. We use Skype. It's our software, so that we can get some instructions and get some help for our patients or the doctor. And so that's very important, that communicating with our supervisor. Another way we communicate at work, which is very important, is with our manager during weekly meetings. We usually meet once a week, and we go over what's new in Orange County and with the primary care, if there's any changes. For example, a recent meeting we had was in regards to the flu. So flu is here. Flu shots are here. It's very important for everybody to get vaccinated to protect ourselves, our loved ones, our coworkers, everyone we come in contact with. So, of course, we're stressing the importance of flu, and we've had during flu season, our group of nurses also carries around a flu pager. So all around Orange County, they set up walk-in flu clinics. And if there's any concern regarding if a patient should receive the flu shot because of allergies or if they're feeling sick, they page us, and we call the flu tent, which is usually a licensed vocational nurse who's about to administer the vaccine. And if they have some questions, our team of registered nurses can help address them. And if we need to escalate that to our doctor, then we do that as well. And we give the okay if it's okay for the patient to receive their vaccination, the flu shot. So going back to the way we communicate with our manager recently regarding the flu, there's PowerPoint presentations that were presented. And so all the new recommendations regarding our flu shots from the CDC was presented to us. So education for our team of nurses is very important, that we know what's the latest and greatest. So that's one way our manager will communicate with us, by holding a meeting and showing a PowerPoint presentation. We also have guest speakers that come and talk about the importance of empathy. We had a recent discussion about empathy, and although it's something that as nurses we are familiar with and have, sometimes to put it into perspective can help us when we care for our patients. So we have that kind of communication at work, which I'm very thankful for. Another way that our managers and supervisors communicate with us is by email. So if there is any upcoming events, meetings, or what we call WebEx that is important to us for like HR issues, compliance, we are notified by email. Classes continuing education classes that we may be interested in, that is all sent to us by email. So email is a very effective way to communicate. And we also receive a monthly newsletter from our regional Kaiser Permanente that also goes over what's going on with our organization at a higher level, which is very important. So again, I just wanted to reiterate to you that it is very important for us to communicate with each other. It affects our patients, it affects our moods, the way we can have a good day or a bad day. Usually has to do with our attitude as well. But effective communication can help improve health outcomes. And thank you very much. I hope you've enjoyed this discussion and presentation about regarding effective communication in the workplace. Thank you.